The first year of life is a crucial time for your baby. Did you know that your baby's brain doubles in size in the first year of life? During this time, the brain is forming connections for important skills like learning language. 2 out of every 1,000 babies may need some extra help with this because they're born deaf or hard of hearing. It's important to find hearing loss as soon as possible because babies start learning how to communicate as soon as they're born. Sounds, facial expressions, gestures, and signs are all building blocks for communication. If hearing loss is found early, children and their families can get help developing communication skills. You can't tell for sure if a baby has hearing loss just by watching them. A baby who is deaf or hard of hearing may cry or seem to react to sounds just like other babies. 95% of babies identified with hearing loss are born to hearing parents. Only a hearing test designed for newborns can tell you if your baby is deaf or hard of hearing. Newborn hearing screening is a safe, painless test and can be done in about 10 minutes while your baby is sleeping. Tiny earphones are placed in or over the ear, and soft clicking or beeping sounds are played. The equipment measures a response to the sound from your baby's ear or brain. If your baby does not pass the newborn hearing screening, it's a good opportunity to find out more about how your baby hears. You can do this by making sure the screening is done again, usually 2 weeks later. If your baby doesn't pass the screening again, an audiology clinic for children can perform a full hearing test. The audiologist will find out why your baby didn't pass the screening. Some families find out it was because of a temporary blockage in the ear. Other families learn that their child has permanent hearing loss, and they begin their journey learning how to help their child. These families are offered early support services, like hearing aids and sign language, that help deaf and hard of hearing children be successful. They also meet lots of specialists and other families of children who are deaf or hard of hearing, who are all there to support them on their journey. Studies show that the sooner you give children the help they need, the better they will learn speech and language, the better they will do in school, and the better they will do socially and emotionally as they grow up. It's important to know that even if your baby passes a newborn hearing screening, it's still possible for hearing loss to show up later. Watch for signs of hearing loss as your baby grows, and talk with your baby's doctor if you're worried. You know your child best, and you are the best person to make sure they have the care they need.